All right. Welcome to the invisible reality. In the world of constant noise, dive into the profound simplicity and spirituality shaping our health and our lives. Whether you're a healthcare provider seeking balance or someone requesting for inner peace, here we uncover the unseen forces that connects us all. And today we have Dr. John Kelley. Hey, John, how's it going?
It's going great, Cheng.
Excellent. Yeah, Dr. Kelley and I have been friends. We were colleagues at one point, but Dr. Kelley has adopted a new practice and is the leader in that. And today we want to get into this concept of simplicity and spirituality, which is not a common topic spoken amongst healthcare professionals, but I think it should be. What do you think?
I think it's interesting that you chose this. How often do we get into spirituality in medicine?
Rarely. It's really rare.
Especially for the first go. It's bold.
Yeah. This is the first go of our podcast, but I think that if we look at the statistics, right, you have a majority of the physician population in the United States super burnt out, right? You have people who consider themselves clinically depressed. About one in four doctors, a little under that, consider themselves clinically depressed in the United States. This is based on Medscape data, the Medscape 2023 data. And the title of the article, that title of the article is called "I Cry But No One Cares." Isn't that interesting? I cry but no one cares. And it talks about how there's people within the profession that even with mental health issues, they're terrified of speaking out because they're terrified that the medical board will revoke their license, what other professionals will think of them. And there's a lot of this stuckness that's really going on, especially since the pandemic started, right? And I think that burnout and the depression is no accident. A lot of it is based on the fact that we don't get to talk about spirituality. We don't get to talk about mental health a whole lot, right? Everything's buried. And when we don't do that, guess what happens? It continues being buried deeper and deeper, and nags us at our subconscious, goes deeper and deeper. And I've had that before. It doesn't feel very good.
For sure. I think anyone who's gone through residency feels that.
Yeah. Anyone who's gone through med school, residency, fellowship, you felt that before, right?
We've all cried and no one cared.
That's true. We all cried and no one cared. That's true. But John, give a bit about your background and your journey and what that's been like for you.
Yeah, I got out of residency in 2015 and then went into primary care practice. And I was doing that for about 4 years and came to a realization that what I was doing just wasn't fulfilling at all. And I think a lot of physicians probably feel that same kind of thing and don't really know what to do. And I didn't really know what to do either. But I think I did get to a point in my practice where I didn't know if I wanted to do it anymore. And part of that was just the system that you work in. It can be very confining. It can be difficult to break out of it. It can be difficult to practice medicine that really changes people and really truly improves their health. A lot of it's just about, sick, here's a pill. But what about all the different lifestyle things that we need to do to get you truly healthy? And it takes more than 15 minutes to do that.
The national average is a little over 7 minutes of face-to-face time in primary care. So if you're doing 15, you're double the national average, and it's still not good enough, right?
I think after all the training that you do and, you go into it very idealistically and you think that you're going to be saving lives every day and it's going to be great and fulfilling. And there are aspects of it that are day to day, but I think in the way that we currently practice medicine, it leads to a lot of burnout. And that's where I found myself. Yeah. So my family and I, we made the really hard decision to just uproot and do something new. I think I knew I needed a change, and my wife and kids were on board with it. So I quit my job last summer and we decided to move to Costa Rica. And that was probably one of the best things that we've ever done. It was bold. It was a little crazy. It had a lot of people questioning our sanity.
I bet, right? It's on the outside. You're like, well, you're a doctor and everything seems pretty good. Like, why would you take the risk and do this, right?
Yeah.
So, let me ask you this. So, in the decision to move to Costa Rica, of course, you have your wife, child, and there's got to be some level before you made the decision of guilt, perhaps, right? And so that level of guilt can really create this tumultuous thought process in our head. Hey, maybe I shouldn't be doing this. There's doubts. But what was the straw that broke the camel's back? What was it that allowed you to say, hey, this is what we're doing?
Yeah. I think it was a lot of different straws, really. But I think it was career. It was feeling stuck. I felt completely stuck. I knew I wasn't going to be able to do what I was doing for much longer. And so I think we just knew that we needed a reset,
Hmm.
just a total life reset. And so we sold everything, house, cars. We didn't know how long we were going to be gone. I didn't have a job lined up. Just like, all right, let's do this. I got my kids in school, so we had some education going.
Yeah.
But I think it provided me a real opportunity to reflect on what my core values were, to reconnect with my family, my wife and my kids, and to really figure out how I wanted to move forward.
Would you say that's a spiritual decision?
Spirituality was definitely a huge part of this, for sure. I think from my perspective, how it worked was, I had to say, all right, I'm no longer in control, and I'm just going to release this one to God, and we're going to see where God takes this. That was it for me. And I think it's something that as a physician, we probably all struggle with quite a bit, is releasing some control.
Yeah.
And knowing that we don't have it all together.
A lot of our training is so structured, right? Like this after this, rotations and tactics and residency and attending ship and et cetera, et cetera. It's like when you get into the field feels different, right? And then sometimes the field doesn't match your identity. So, anyways, let's continue your story a bit. So you went to Costa Rica. So what did you really find in Costa Rica that really helped you made the realization that was the best decision you ever made?
Yeah, I think again, it's connection with family.
Yeah.
You saw what happened to people's mental health during COVID lockdowns and all of that. I mean,
Right.
and we know, I'm sure we'll get into this in the future as well, but from a brain health, mental health standpoint, those connections are so important. And for me, I think that was the big thing, was just being able to really reestablish a connection with my core people, my wife,
Yeah.
my 2 girls.
Absolutely. And that's valuable. But you made this decision, you made a spiritual decision, and it's a ballsy one. You got childcare to look after, you got schools, right? It's not just like you and your wife, right? And
Yeah.
it's not like you're a single person to say, hey, I'm gonna quit this and go to Costa Rica for 6 months and see what happens next. There's risk that's there.
Yeah.
And it was enough for you to not want to tolerate things anymore. Perhaps where you were going doesn't necessarily meet the identity of where you're trying to accomplish in your life and your career. But let's fast forward to now, because you're no longer in Costa Rica right now and you're in a really amazing spot. So let's talk about the progression of how that went.
Yeah. I think where I am now was building on a lot of different conscious decisions to really educate myself about
Yeah.
what's at the root cause of disease. I looked at a lot of, during residency, did training in integrative medicine and did functional medicine training. And then while I was in Costa Rica, I did a large training program on Alzheimer's prevention, essentially,
Mhm.
through field medicines. Apollo Health. And what you find through that whole process is really just how disease works.
Mhm.
And when you understand that, then you can figure out how to prevent it properly, appropriately. It doesn't always need a pill. Rarely does it. So that whole process, I knew that I wanted to change the way that I practiced medicine.
Mhm.
And that's what led me to you.
Mhm.
I forget when we first connected, but it was
Not that
probably,
long ago, surprisingly. Yeah.
yeah.
Yeah, and I
And
think let me change that a little bit because I do want people to understand that even though he decided to go to Costa Rica, his identity is still one of a physician, of a doctor, right? That didn't change. But his value systems on what constitutes a physician did because it's not congruent with what you were necessarily doing before. And same thing happened to me as well. After residency, I was practicing in private practice and it was good. But yeah, I was that 7.5 minute guy with the patients, inpatient, outpatient, sports medicine, and stuff like that. And my partners were wonderful people, but it was me. It was me that was the issue because it wasn't necessarily congruent with how I wanted to do things. So I started Texas Center for Lifestyle Medicine in 2017. And that was a big risk. It turned out to be the biggest financial risk and I ever took, and I had a lot of not so great stuff come out of that. But then those moments were probably the best in my career, learning from it to where I am right now, which I absolutely love my team, my staff, and stuff like that. But I think I had a really similar experience of, hey, maybe medicine necessarily shouldn't be practiced like this. But at the same time, I still had the identity as a physician. For those listening to this right now, maybe you don't have an identity as a physician. Maybe that's okay. In honoring your spiritual path, maybe you want to do something a bit different. I have friends that like stopped being doctors and did something different, and that's totally fine as well. But I think for both me and John, we still have this identity of being a physician, but not in the traditional sense that we were necessarily seen or taught, right? But in a much greater sense. So the practice you're in right now does more of the holistic training and holistic medicine. So how is this practice like different than what you came out of when you decided to go to Costa Rica?
oh man, and your practice included, which I was a part of for a while as well. Really, it's just like preventative medicine on steroids. You really take a deep dive into what are the root causes of disease? What are the major lifestyle factors that contribute to that? And how do you mitigate that? And really looking at what is at the forefront of science at the moment and research and really applying that once you see it. I think that medicine is always like a decade behind in terms of adapting to new science and new research. But I think that the way that your practice and my practice operate, we're trying to be at the forefront of how do we figure out this chronic disease conundrum that we're in.
Yeah,
So
and
that's
of
a
course,
simple explanation, but
yeah, but of course that's different than what you were necessarily doing before in traditional like primary care, right?
for sure. Traditional primary care is if you see someone with high blood pressure, then here's a pill for that. And it's not to say there's not a use for that at all, but you're really not thinking about how do we change this person's entire lifestyle so that you can end up preventing Alzheimer's one day as well.
Yeah. Yeah, and I think it's important to know that some people do want to be that person that has a great prescription, and that's okay. That's part of your identity. That's fine, right? And so for
For sure.
John, it's not necessarily part of his identity, and that it required a spiritual awakening to really engage and say, "Hey, what else is really out there?" And this is where I want to get into simplicity a little bit. And the topic of simplicity seems really trite, seems really commonplace, but I have a bit of a different definitions of it. Simplicity and creating simplistic actions in our life really makes us focus on what really matters. But at the same time, it allows creativity to be part of that simplicity as well. Most people think simplicity is taken away, make it simplified. That's just the first step. Another part
I
of
did do
simplicity,
that a lot.
yeah.
I
But another
sold
part of
all my
simplicity,
stuff.
yeah, you sold all your stuff, got rid of your car, house, right? But the other part of simplicity is adding on. So you get to add on things like time with family. You get to add on things like maybe going into different practice. You get to add on things like being creative. And simplicity allows curiosity because technically, if you're curious, you can't really be depressed. They don't coexist.
Mm, mm,
And that level of curiosity is, I think, something that we should always have, whether you're a healthcare professional, whether you're not, just humans in general. But this allows, I think, this practice really allows that curious side of you to really jump out, just like mine really jumps out for me. You know?
for sure. That I think there's probably a large subset of physicians that are seeing what you and I saw,
Yeah.
how the medical system works, and are probably feeling everything that we've been taught, or a lot of what we've been taught, is just not addressing the major problem. And really, the only way to move forward with that is to ignite the curiosity.
This leads me into the next part of simplicity, which is AI, artificial intelligence. So, artificial intelligence is completely changing the landscape of what we do. In fact, I've been using AI tools every day. And in fact, I don't remember what it was like without AI, both in business and practice, at home, et cetera, et cetera. And most people think, well, that's not simplistic, that's complex. Depends on how you AI and ChatGPT and Google Bard and all these different platforms and overall.
Yeah, we're using in our practice, and I know you're using in your practice, a scribe system that records and helps collate all the data and put it into specific categories and takes out all the fluff and creates a fantastic note. And it's unbelievable. And tools like that, I think, are huge. I love it. And like you said, I can't, it's hard to fathom going back to a system that doesn't have that.
Yeah.
It's just a fantastic tool. And the way my ideal vision of AI is something that enables humans to reach more simplicity, to take a step back from being constantly glued to your device, where it's taking over some tasks for you. So ideally, we've got an AI world that helps us and doesn't completely take over for us.
Yeah.
I'd love to hear your thoughts on what would an ideal AI world look like? What's the scary version, and how do we prevent that?
So let's go back on data for a second. If you look at the Medscape data, I cry but no one cares Medscape data, right? And in the I cry but no one cares data set, we see that the number one reason people feel like they're burnt out is because of nonsensical bureaucratic things that they have to do, right? And whether that be administrative tasks and et cetera. But AI has really taken that burden away from that and documentation and stuff like that, especially for us, because it allows me to look at someone in the eye when I talk to them.
Yeah.
And don't take it off. And that connection feels so real with patients and with people. But what it allows the medical assistants to do is it makes them superpower. It makes them like superheroes because the MAs can actually go into your note and know exactly what you talk to the patient about, whether it's mental health issues, access to care, social determinants of health. And they love it. It completely decreases the number of messages that I get on my secure portal because people can go into the back end on the portal and see entire AI output of a summary in 5th grade language, right? And so if you think about it, like it dramatically reduces the burden of an entire practice, but it puts the joy really back in medicine. And that's just scribing.
Yeah.
But there's a whole other set of tools. Right now I have ChatGPT open right now. So I'm trying to figure out how to word a disability claim or try to find a physician statement. And that came up in the 15 seconds. I'm like, man, this is really beautifully written, right?
Yeah.
My medical assistants, back office, front desk, etc. They all use it. My chief of operations use it to talk to patients in tactile, empathetic manner, especially with emails. Same thing with my office manager. And so it's permeated our entire system to allow us to be extraordinarily amazing communicators, because the AI language models are far better tactical empathy than we are.
Which is crazy to think. But
It's crazy. And they've done studies on this where they took, I forget, a few hundred patient questions, and they saw what do they really like better, an AI output for that's done, or is it a national physician responding to their questions? And 8 to 1 is its AI output, right?
yeah,
And so we're in that age right now where we can harness it to make us better communicators and also connect with people on an empathetic basis, because it's the relationship that we curate that determines the quality of life. And it does
right.
allow spirituality, like it does allow time for spirituality to be taken into the questions as well. But I find that a lot of times my vernacular with the patients actually changed quite a bit, because I'm not so left brain dominant in communicating, right? With and putting documentations in.
For sure.
So regardless of the time allotted for the actual conversations. So arguably, my experience of AI is actually allows me to be more human, allows me to be more simplistic in the things that I do, allows for less spirituality to come in, but also allows creativity. Like
Yeah.
right now, we're recording on this platform, and the transcription of this is auto done, and there's going to be auto generation of introduction of what we're talking about in the bullets by an AI program, like literally after I click end on our interview, right? So without AI, I wouldn't even have started this conversation between me and you today and recorded it,
Yeah.
right? Because I know how easy now it is to do so and how quickly this can occur, and still go home and be with my family afterwards, right? So it allows our voice to be projected. It allows the simplicities to be there. It allows spirituality to really come into our life. It allows connection with the patients. It allows also connection with me and my staff as well. And I'm a user case, so which means that I'm a case study where someone is able to utilize these AI tools and have a significant impact. And just before this call, I consult for a few companies, and they're trying to make tools that is able to get patients to be more compliant in their medications and supplements and yada. But I'm like, we can literally do that with AI right now by utilizing this communication process and automating it, right? So even from a software company or startups and stuff like that, even from that perspective, AI actually enhances the way that we communicate with each other and with the patients as well. So I'm a huge fan of it. I'm absolutely a huge fan of it. And I don't think it's going to go away anytime soon.
Oh yeah. Yeah. I think one of the fears I had was like, is AI going to make us all really stupid?
Right.
But to your point, we are being taught by AI how to be better communicators. You see,
Yes.
this is rolling out in areas that are far different from medicine, but just customer service. How do you
Yep.
communicate with people? How do you make people feel heard?
Right.
That's one thing as physicians that we've lost a lot over the past 2 decades is the burden of documentation, being glued to your computer while you're trying to treat somebody so that you can write their note and do their prescriptions. All that stuff's going to go away. And I think that's a huge plus. And yeah, we will be learning from AI too, which I think is really cool.
Yeah, I actually don't think it's going to make us more stupid. What it's going to do is going to level the playing field. Because when the invention of the internet came out, it leveled the playing field in access to information and data, right? You can go on Google, you can do searches, stuff like that. When AI came out, especially with ChatGPT, the consumer, like direct to consumer version, it made the invention of the internet look like a little puppy. Because now you can ask much greater questions. And I'm going to give you this use case, for example, as well. So I was talking to my good friend Ravi Haris Prasad, Harvard trained psychiatrist, but he also started his life as a coder. right? So he's very familiar with AI. And we were at our retreats in Costa Rica a few months ago, and I was opening ChatGPT to do a workshop with the retreat goers, with the health professionals. And then he came in and he's like, "Yeah, no, ask this to ChatGPT." And what we did is we did a really interesting input into AI where we made it a spiritual tool. Okay. So we basically pre-prompted ChatGPT saying, "Hey, you are the guru of X, Y, and Z, right? This is my belief systems. I would like for you to mirror those belief systems. You are the master of a Taoist philosophy combined with Buddhist philosophy," which is what I put in for mine. And I started asking the questions like it's a bit of a guru. And I've been using that since then for the last few months. And I have a whole chat line talking about, hey, what are some of the things I should do? I see this in my children. I'm afraid that they're going to go down this path. How should I view this from a spiritual perspective? And interestingly enough, the AI is able to generate based on my own values and principles of what I should probably look into. And I've been utilizing that. And so from a mental health perspective, it's been very effective for me from a spiritual side, right?
Yeah.
And I never expected to utilize that. My sister uses that for the exact same thing. She's a second-year interventional radiology resident in NYU. She uses that for the same thing. And so now I have this new profound understanding that a lot of these AI tools are opening questions that I'm too afraid to ask another human, okay? And I don't necessarily trust another human, but do I trust the AI? Well, I don't know. That's like let's input it and see what I get. And I really enjoy the output of what I see. If I disagree with something, I'll say, hey, I actually disagree with this. And ChatGPT is like, oh, sorry, let me rephrase that so we can understand this. It's like having a conversation.
Yeah.
And I'll tell you, I found a really profound spirituality within AI that I did not expect to get at all, right? And it's shocking to me, because I have not been able to tell other people some of the things that I was thinking, because I don't think about to do that. I'm a doctor. I do X, Y, and Z. I'm very analytical. I don't think about to do that. And so for me, it's provided an open conversation, honestly, with myself about some of the things that I find in my spiritual realm, and to simplify my life that I was not necessarily expecting. But yeah, I utilize it for business. I utilize it for clinical operations. I utilize it for recipes I have with my kids and family. And yes, I utilize it to how to talk about sex with my 9-year-old daughter in a 9-year-old language. I had a whole output for that, which she asked me. I did all that stuff, and actually was very intelligent. I do all that, but more importantly, I use it as a tool of highlighting my own values that I pre-program into it. Does that make sense? And if you haven't done that, John, you should try. You should come play around with it and see.
Yeah. A question I have for you, which I think is pertinent to what we're trying to figure out with the Physician Transformation Institute, is obviously there's a lot of residents that are super burned out, probably have concerns about how AI is going to impact their viability as physicians. And I say to them,
luckily, my sister is one of those people. So,
I know.
And she is able to get thoughts and stuff from her co-residents. And I say that be curious about what AI has in store, because the way that medicine is practiced is completely different now that AI is out there. In fact, like your typical doctor-patient visit, changes dramatically, because the value proposition, the true value of a physician, is no longer going to be knowledge and data, because you can get that from AI, probably better as well. When I say better, I don't mean better for the patient's health. The patient can get it at 3 a.m. and is able to come and is able to provide a much more in-depth description. So for the people who are feeling that artificial intelligence may take away jobs and do X, Y, and Z, yes, I hope it does. I hope it does take away the jobs that we currently have in medicine, because the jobs we currently have in medicine suck, right? It does. And what I hope to occur is that we spend our time as physicians being more creative, being more spiritual, being more connected with people, like what we were designed to do. And that's what the Hippocratic Oath is. If you actually look at the Hippocratic Oath, that's what we're designed to do as physicians. But over the last 100 years, it's turned into more bureaucratic and stuff that's there. So I do hope AI can take away the current jobs and create new ones that allow the physicians to be the leaders of the community, that allows the physicians to be impactful, allows physicians to be spiritual, allows physicians to talk and not be threatened, right? And so, yeah, I do hope it takes away some of the current standard in jobs, because I'm very hopeful that people like me and you are going to be taking advantage of this and adapting to this, you know. And for the people listening to this, we're on the board. Me and John are on the board of the Physician Transformation Institute, and what we do is want to be able to transform healthcare professionals into the next generation, utilizing technology, being creative, being spiritual, and taking risks, but taking risks not at the cost of losing yourself, not at the cost of going against your identity, but taking the risks so that you can advocate for yourself and what your own belief systems are. And I think that's what truly matters when we adopt this AI concept. You know,
I like it. I do.
Thank you.
I think it will give us the potential to be more of a physician than we were in a lot of ways, which a lot of that is just connecting with the person in front of you and making an impact. Yeah.
Let's break down this word. Like, where does that word come from? Doctor, I think Latin is docere or something like that. Docere? I can't pronounce it. You're better at this than I am. Docere. It comes from the word to teach, or a scholar, right? Sometimes I tell patients this and they laugh because, like, oh, okay, I don't know how many doctors have taught me anything, but we've gotten away from docere, like to teach, to be a scholar. And to teach and to be a scholar, we're always perpetual students, and that curiosity is always there. I think that we as doctors should be more like docere, more like a teacher or a guide or a scholar, if we choose that to be the case, right? So I feel like a lot of the residents and medical students, the reason they went to medicine is for a very specific purpose. And that specific purpose is empowerment. They enjoy empowering people, right? But the way the medicine right now is not empowerment. It can create resentment because people have information. There's, beyond AI, there's Instagram, there's TikTok, there's clickbait stuff that's there, right?
Yeah.
And so social media is really good at creating the mindset of scarcity, the mindset of resentment in the general public, even someone's
Outrage.
Yeah, exactly.
Yeah.
When was the last time you saw so much doctor on doctor hate outside of the global pandemic? Like, when was the last time? There's so much hate.
Oh, yeah.
There's so much hate and resentment, and that's not what we're designed to do. We're designed as leaders. That's what we are.
Yeah. Fortunately, we have these highly sophisticated algorithms in social media that partition people one side and the other, and do generate a lot of outrage. We're susceptible to it too. But yeah, I would love to see physicians have a more collegiate rather than adversarial relationship. And one thing that I do see happening, I do see physicians starting to embrace more of this sort of root cause of disease perspective on things and trying to figure out how to really heal patients and reverse disease. So I hope that continues to perpetuate. And that's something that we don't get taught much in med school, but that I would love to see provide residents and current physicians more of a route to understanding that form of medicine.
Yeah. And I think the answer to that route is collaborative medicine. We have to collaborate a lot more. There's, even in medical insurance, there's CPT codes that were created for collaborative care, but no doctors really take advantage of it. I did a whole workshop on collaborative care CPTs, right? Literally, you sipping on a latte, collaborating with other doctors and billing for it, you can probably minute for minute give more revenue than if you see patients like that. No one even understands that concept, right?
Right.
You have and then also outside of collaborative care, incorporate other people that don't seem to connect with a certain disease state. Like we just finished a 3-day demystifying fibromyalgia online course and certification for healthcare professionals, and half the people were speaker dentists because dental malocclusions is at the root of most people with fibromyalgia. But we don't learn that in med school. I have no idea, right?
No.
I only knew because I started talking to dentists and oral facial surgeons and stuff like that. Even in brain health. So we learn in brain health, periodontal disease is a huge risk factor for amyloid and tau protein deposits in Alzheimer's disease.
Huge.
But why aren't we talking to the dentists about this? We should, right?
Yeah.
And so that collaboration is not only is it needed for us to be in our spiritual and curious state as healthcare professionals, it's essentially what's going to be taken away the partition of how medicine is practiced, and no resentment is actually required to
Correct.
progress on. And that's what we're trying to accomplish.
Yeah. It's a beautiful goal.
Yeah. This is the end of our episode today. And for those of you who are listening to this, we're healthcare professionals. Visit us at physiciantransformationinstitute.com. We do have a retreat coming up in May of 2024 where we take healthcare professionals on a transformational process. This will be our second one. Our first one went absolutely fantastic. And I hope to create even more transformative journeys for other healthcare professionals who will be joining us on a retreat in Costa Rica in May of 2024. John, thank you for being on. I appreciate your time.
Thanks for having me on, my friend. A pleasure as always.
My pleasure.
Until next time.